from head to toe, from dermatology to pediatrics to rheumatology, every department has a data, right? And addressing the other question, a lot of people ask, will AI take over? Will AI come into picture? This is, when people speak about it, all I can say is that understanding of AI is limited. So I know a lot of people out here, they know it's all about numbers. It's not that what we call, we can automate certain things, but ultimately the diagnosis, it is a multi-dimensional one. Even with 20 years of experience in neurology also, sometimes you won't know a patient. So that is something which will be always with the humans, whether it is not in healthcare, across any industry. But what we can use this technology to automate as a screening tool, where this information can go down the line to the patients, right? So that people, if they want to understand certain things, they can start interacting with these kind of tools to get things better. So that's a way that we can look at it, how it can automate so many things. So I think with that, the next plan is we'll show a video, and then probably it's just a short video where we will describe. Obviously, I can't bring the ultrasound, all those things out here for display, but post this, I would definitely welcome you who are interested in batches. We can definitely invite you to the hospital. You can come there. We can probably explain in much more detail depending upon. I'm the neurologist at Aster CMI HOSPITAL. So neurosonology, in that specifically neuromuscular ultrasound. So I've been doing it for almost a decade. And as mentioned by my previous colleague about its various applications, so a thought came up whether using the technologies of AI and machine learning and deep learning, whether we can automate a certain process. Nerve ultrasound needs a learning.
Professor of Medical Imaging at University of Science, Bangalore. We primarily work in the area of AI for medical imaging. We have been collaborating with Aster CMI Hospital for the past 1 year by establishing Aster AI Lab, where the aim is to develop some of these AI methods and translate it to the clinic. So to this effect, we have been working on automated segmentation of the median now.
Hello everyone. The healthcare landscape is rapidly shifting from a prescriptive to predictive model, and AI is driving a significant transformation. At Aster, we have been in the forefront, seamlessly blending human expertise with AI to usher in a new era of healthcare excellence. Join us in collaborative efforts with providers, researchers, and innovators to unleash the full potential.
Its technology meets compassionate care. Together, we are creating that reality. At the intersection of innovation and healthcare, we are forging a new frontier. Yes, I'm talking about the transformative power of artificial intelligence in the healthcare industry. And to make it a reality, we have partnered with the Indian Institute of Science, Bangalore, to pioneer an AI-based application which will help doctors understand their concerns and provide a personalized solution to the patient seeking medical.
Dr. Anuradha, Consultant Neurologist, Aster CMI Hospital, Department of Neurology. So today we'll discuss about neuromuscular ultrasound. So what is this neuromuscular ultrasound? It helps other electrodiagnostic studies to refine our diagnosis when it comes to neuropathies. For example, electrodiagnostic studies help us in understanding only the physiology, how the nerve is working.
Noted here. As mentioned, the two problems which we wanted to solve. The first problem is auto-segmenting or auto-direction of the nerve. As you can see the arrow mark here on the screen where the ultrasound is there, and here we have the green contour which is depicting the model of the nerve. For any machine learning task, we need the data and also we need to annotate. Annotation is an important part here. So for any model development, we need to give to the model both the input and the label. So we used imaging.
Many programs and many libraries importing is important, and in this there is a program dataset loader This is loads the data, and after that it has another program.
This was one of the event where there is a collaboration between the healthcare providers and the technology professionals. Okay, and the way forward for artificial intelligence in healthcare, it is a collaboration between healthcare and the technology, and where professionals from two different domains or two different expertise come together, and then we try to provide solutions for the patients so that it can help them in early diagnosis, screening, and then a precision treatment that we can provide, and it can benefit to the patients and it can benefit to the humanity. So this is what the meeting was about, and also we showcased one of the product that we developed in collaboration with Indian Institute of Science, so that how it can be applied in real time, and how it can help in solving the diagnosis, or in in rationalizing the treatment for our patients.
Is it more effective?
Yes. So any technology for that matter, say in healthcare, it is always the technology has made a big difference. Say for example, earlier a simple chest X-ray, it made a difference for chest diseases. Then you have a CT scan. Then similarly for the brain, we had a CT scan of the head, later on MRI. So likewise, the technology definitely aids the clinicians, and definitely it helps in screening, diagnosis, as well as treatment. In the same way, AI is also an additional technology that will definitely bring in a better change in terms of treatment and better care to our patients.
ಇವತ್ತು ಲಾಂಚ್ ಲಾಂಚ್ ನೋಡಿದ್ರಿ. ದಿಸ್ ಇಸ್ ಆಸ್ಟರ್ CMI ಮತ್ತು ಇಂಡಿಯನ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಸೈನ್ಸ್ ಕೊಲಾಬ್ರೇಷನಲ್ಲಿ ನಾವು ಈ ಮಾಡೆಲ್ ಅಂತೂ ತಂದಿದ್ದೀವಿ ಫಾರ್ ದ ಫಸ್ಟ್ ಟೈಮ್. ಇದು ಲೈವ್ ಮಾಡೆಲ್, ಯಾಕೆಂದರೆ AI ಅಂತ ನಾವು ಸುಮಾರು ಇದೆಲ್ಲ ನೋಡಿದ್ದೀವಿ. AI ಇಸ್ ಅ ಬಿಗ್ ಥಿಂಗ್, ಬರ್ತಾ ಇದೆ ಅಂತ. ನಾವು ಆ್ಯಕ್ಚುಲಿ ಇವಾಗ ಕಂಪ್ಲೀಟ್ ಪೇಷಂಟ್ ಸೆಂಟ್ರಿಕ್ ಒಂದು ಮಾಡೆಲ್ಸ್ ಅಪ್ರೋಚ್ ಮಾಡಿಕೊಂಡು we have ensured that this particular model is live and going with the support of Indian Institute of Science. So we are glad to say that as a hospital we are just not talking a topic. Now we have really gone into the acting, actually putting into the act.
ಸರ್, ಇದನ್ನು ಬೇರೆ ಯಾರು ಬೇಕಾದರೂ ಕೊಲಾಬ್ರೇಟ್ ಮಾಡ್ತೀರಾ, ಅಥವಾ ಈ ತಂತ್ರಜ್ಞಾನನ ಬೇರೆ ಯಾರಿಗಾದರೂ ನಮ್ಮನ್ನು ಅಪ್ರೋಚ್ ಮಾಡಿದ್ರೆ ಅವರಿಗೂ ಪ್ರೊವೈಡ್ ಮಾಡ್ತೀರಾ?
ಇದು ನಮ್ಮದು ಆಸ್ಟರ್ CMI ಆಸ್ಟರ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಅಂದರೆ ಇಟ್ ಇಸ್ ಮೋರ್ ಆಫ್ ಟೇಕಿಂಗ್ ಕೇರ್ ಆಫ್ ಪೇಷಂಟ್ ಮಾಡೆಲ್. ನಾವು ಬೇರೆ ಥರ ರಿಸರ್ಚು ಮತ್ತು ಬಿಸ್ನೆಸ್ ಅದರಿಂದ ಒಂದು ಇದು ಮಾಡಿಕೊಂಡು ರಿಸರ್ಚ್ ಇದರಿಂದ ಬಿಸ್ನೆಸ್ ಮಾಡೆಲ್ ಅಂತೂ ಮಾಡಲಿಲ್ಲ. ಇಟ್ ಇಸ್ ಸ್ಟಿಲ್ ಪೇಷಂಟ್ ಡಾಕ್ಟರ್ಸ್ ಇಂಟ್ರೆಸ್ಟ್ ಹೆಂಗಿದೆ, ಇವಾಗ ಡಾಕ್ಟರ್ ಲೋಕೇಶ್ ಅವರು ಇದು ಮಾಡಿದ್ದಾರೆ, ಅವ್ರ ಇಂಟ್ರೆಸ್ಟು ಇತ್ತು ದ್ಯಾಟ್ ಹಿ ಹ್ಯಾಡ್ ಡನ್ ಪ್ರೋಗ್ರಾಮ್ಸ್ ಕೋರ್ಸಸ್ ಆನ್ ಆರ್ಟಿಫಿಷಿಯಲ್ ಇಂಟೆಲಿಜೆನ್ಸ್. ಆವಾಗ ಅವ್ರು ಬಂದು ಹೇಳಿದ್ರೆ ಈ ಥರ ಪೇಷಂಟ್ ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ ನೋಡಿ, ಕ್ಯಾನ್ ಐ ಪಾರ್ಟ್ನರ್ ವಿತ್ ಇಂಡಿಯನ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಸೈನ್ಸ್, ದೆನ್ ಕ್ಯಾನ್ ವಿ ಗೋಡ್ ಅಂತ. ಆ ಥರ ಏನಾದರೂ ಮಾಡೆಲ್ ಇದ್ದರೆ ವಿಚ್ ಇಸ್ ರಿಯಲಿ ಗುಡ್ ಫಾರ್ ದ ಪೇಷಂಟ್ ಔಟ್ಕಮ್, ನಾವಂತೂ ಮಾಡ್ತೀವಿ. ಬಿಸ್ನೆಸ್ ಮಾಡೆಲ್ ಅಂತೂ ಇಟ್ ಇಸ್ ಅ ಡಿಫ್ರೆಂಟ್ ಸ್ಟೋರಿ, ಅದಂತೂ ಇವಾಗ ಏನು ಅನಿಸ್ಕೊಂಡಿಲ್ಲ.
ಥ್ಯಾಂಕ್ ಯು.